Hi everybody, my name is Dr. Karin Duncan. I'm a naturopathic medical doctor at Coeur d'Alene Healing Arts in beautiful northern Idaho. I'm also the co-founder of a free online resource called the Cerebral Advocate, where we help guide you along through nutrition recommendations given to you by your physician as you navigate Parkinson's disease. We talk about weekly meal plans and provide printable grocery lists and other kitchen tips and tricks to make this transition a little bit easier for you. Welcome to this presentation today called PD Lab Values Decoded, the how, the why, and the what happens next. This recording is from the Northwest Parkinson's Foundation, and with so much gratitude for all of the services that continue to provide our community, even in the midst of a global pandemic. Today we're going to discuss some blood tests, urine, a little bit of hair and stool, and we're going to finish out with a breath test. These topics can be a little bit dry, so I suggest grabbing a nice beverage of choice and maybe even grabbing your own lab results so you can flip through them and figure out what might be pertinent for you and jot down some questions that you may want to bring to your next doctor's appointment. The first point I want to make before we jump into lab ranges is really, what is a reference range? How do we determine what a reference range is? The number that you get for a lab test result only has meaning when it's compared to a reference value, and these are typically derived from an otherwise healthy population. There's two kind of challenges when it comes to lab reference ranges, or lab results in general. The first one is, what defines a reference population? If it's typically an otherwise healthy, normal population in their middle ages, and then we take all of those values, and the values that fall within 95% of the middle are considered normal. So that's really how we derive the reference range, through math and statistics, which is great, and it gives us a starting point, a guide, if you will. However, when I get my blood drawn, there is no reference range for a 38-year-old female, new mom, in the winter time with a stressful job. So I think individual health really needs to play a part in when we evaluate these reference ranges. The second obstacle here is that a lab is a snapshot in time, for the most part, of what your blood and physiology is doing right then and there. So again, when we look at lab reference ranges, it is important to recognize when there is safety at play, and we need to challenge those reference ranges and make sure that we keep you healthy and safe based on those, and when we're monitoring medications, but also take some of them with a grain of salt, knowing that at that moment in time, that's what your physiology was showing. So those are normal reference ranges. When we talk about optimal reference ranges for people with Parkinson's, I give the credit to Dr. Lori Mishley, Parkinson's guru and researcher. She's adopted the positive deviance model from Tufts University and created a research format called CamCarePD, and it's located here at camcarepd.bastyr.edu. Essentially what she's doing is polling thousands of people with Parkinson's, taking in all of the variables, and then one by one going through to figure out what reference range is optimal for people with Parkinson's to slow the progression of the disease. So as we go through, and I mention reference ranges throughout this PowerPoint, I may also offer some optimal reference ranges for somebody with Parkinson's disease. The next point I want to make is when we talk about supplements is recognizing, as this quote is right from the FDA website, that the FDA doesn't actually have the authority to review dietary supplement products for safety and effectiveness. What does this mean? Quality products and therapeutic dosing are very important when we talk about supplementation. Your naturopathic doctor has a consumer guide and quality assurance distributors to know which products actually do match label potency, and research to determine what is therapeutic dosing for certain conditions and symptoms. Please have a conversation with your provider before you start supplementation. Supplements do not always equal natural, and natural doesn't always equal safe. So the first test we're going to dive into is a CBC, or a complete blood count. A complete blood count is a broad assay of your overall health. It's going to look at your white blood cells, your red blood cells, and immune cells. This test can screen for anemia, autoimmune systemic disease, immune health, B12 and folate deficiency, medication and management decisions through your disease process, and other chronic infections. This is really important to continue to monitor because subacute or insidious infections can actually inhibit the efficacy, absorption, and metabolism of specific nutrients, medications, and supplements to help slow the progression of disease. A CMP, or a comprehensive metabolic panel, is a panel that looks at our liver, organ function. And this includes your liver and your kidney. Both the liver and kidney maintain normal blood chemistry and are important elimination and detoxification pathways. The liver is very imperative for metabolism of treatments, and the kidney is really great at electrolyte balance and making sure that we assimilate some of the treatments for Parkinson's disease. Some of the levels that we may look at, for example, is a BUN, and we want to maintain that sweet spot in the middle because low could show a deficit of key amino acids that we need to make dopamine, and if it's too high, we can actually have elevated ammonia that can also affect our brain health. So it's important to look at all of these lab values and take into account how they need to be normal for their own function, and as well as what they do to participate in the progression of this chronic disease. Electrolyte balance is something really important to manage and monitor because it can help with some of the common symptoms of Parkinson's, like orthostatic hypotension. Blood sugar is another level that we see on a comprehensive metabolic panel, and that paired with A1C is going to give us a picture of how you're regulating your blood glucose. Both high and low blood sugar can impact neurological health and affect the progression of Parkinson's. Chronically high blood sugar is actually associated with an increased rate of brain atrophy or loss of function. And neurodegenerative diseases have been coined type 3 diabetes, as you are actually 4 times more likely to develop Parkinson's disease if you have diabetes, and if you have already had the diagnosis of Parkinson's, the progression has been shown to be faster. High sensitivity CRP. CRP is a protein released by the liver in response to systemic inflammation and cardiovascular injury. It's significantly higher in people newly diagnosed with Parkinson's versus healthy controls. High CRP levels are also associated with a twofold risk of developing Parkinson's, faster progression, and worse outcomes. In fact, a level above 0.8 is actually associated with a decreased lifespan in people diagnosed with Parkinson's disease. This is an example of where an optimal range differs from what you're going to see in your lab printout, and we're looking for less than a 0.5 for somebody with Parkinson's disease. High glycemic load is significantly associated with plasma CRP levels, and we combat this with a Mediterranean diet, high intakes of carotenoids through vegetables and fruits, and supplementation with fish oil and vitamins E, D, and C. CRP can be elevated, and when we have that high inflammation, sometimes it's really difficult to know where it's coming from. It's really important to stay on top of your dental health, as small insidious dental infections can elevate your inflammation levels in your body. Another place that this can stem from is chronic urinary tract infections. Homocysteine. Homocysteine is a byproduct of methionine metabolism. Really what we're looking here for is an elevated homocysteine level in the blood, which would indicate a deficiency in either folate, B12, B6, or betaine. Levels above 11 can be neurotoxic, and an optimal level for somebody already diagnosed with Parkinson's is below 7. We supplement with folate, B12, B6, and betaine to help lower those homocysteine levels, so we don't get the consequences of an enhanced rate of Parkinson's disease, cognitive decline, or also we have the dementia, depression, cardiovascular disease. There are other factors here that can lead to elevated homocysteine levels or to a deficiency of one of those nutrients. Chronic levodopa use is one of the main ones we look at, especially for somebody with Parkinson's disease. If you have been prescribed levodopa through any route, it is really important that you ask your prescribing physician to run a homocysteine level to ensure that we are also supplementing with these important nutrients to keep that level within normal range. In our metabolic evaluation that includes lipids and triglycerides and also the A1C, which we chatted about with the blood sugar, we're looking at your cholesterol. Cholesterol is a building block of every hormone in the body, and it comprises 60% of our brain tissue. Low cholesterol actually can indicate an increased PD progression, neurological issues, and psychiatric problems. If somebody presents with low cholesterol, it's also an indicator of potential malabsorption or malnutrition. If we have too high of cholesterol, then that's an indicator for cardiovascular health, and we're all very aware of that risk factor. An optimal range for somebody with Parkinson's is between 160 and 200. If your cholesterol is extremely elevated and you're recommended to take a statin, which works on the HMG-CoA reductase enzyme in the metabolism of cholesterol in your body, it actually can deplete CoQ10, which is necessary for mitochondrial function in your cells. If you are taking a statin or are prescribed a statin, ask your healthcare provider about also adding a CoQ10 supplement along with that. Triglycerides are a type of fat found in your bloodstream. These can be very detrimental and impede cerebral blood flow. Supplementation with fish oil and increased fiber in your diet can help lower triglyceride levels. We want to do a full evaluation of your thyroid for most patients, and especially if you have Parkinson's disease. Symptoms of a hypo or low functioning thyroid can overlap with Parkinson's disease to include fatigue, constipation, dry skin, and depression. They can overlap, mask, or exacerbate these symptoms, and we want to make sure that we're treating accordingly so we know exactly which alligator we're attacking here. When we run a full thyroid panel, this includes the TSH, which is thyroid stimulating hormone, with a range from 0.45 to 4.5, which is extremely broad, and also the free T3 and T4, which are the active hormones in your body. It's also necessary to look at your autoantibodies for thyroid on your first initial panel. A low autoimmune activity on your thyroid can impair the function, give false normal readings for other lab values in your thyroid, and also help modulate the immune system in a way that's actually going to help enhance treatments for Parkinson's. Again, I fully suggest asking for a full thyroid panel on lab evaluation from your primary care provider. We check for iron and ferritin because the dopaminergic neurons are concentrated in a part of your brain called the substantia nigra, or the black substance. It's black because there's a high amount of iron there, because iron is a necessary part of dopamine production. Iron is readily oxidized and therefore creates a lot of damage. So we do want to check your iron levels and make sure that you don't have too much iron, therefore being at risk for more damage to kill those dopaminergic neurons we have remaining. Other indications for testing your iron would include anemia, GI bleeds, blood disorders, and chronic inflammation. If you are low in iron, we also want to treat that as well, like anemia. Keep in mind that nutrients and supplementation can affect the way that you absorb iron. Citrus is going to increase that absorption of iron, and black tea is actually going to decrease your ability to absorb iron. People who express the hemochromatosis gene, non-menstruating women, men, and people with high red meat consumption are at risk for elevated iron levels. Ferritin is your reserve of iron that you keep in your body. We also run this because it acts as an acute phase reactant. Similar to CRP, it's released from the liver when the body is under systemic inflammation. So it's another good evaluation to see how our body is reacting to its environment. We run a serum B12 and methylmalonic acid to look for serum B12 deficiencies. B12 deficiency is the most common deficiency in our aging population, and again, symptoms can overlap with common Parkinson's symptoms to include dementia, a balance disorder, tremor, fatigue, even an impaired sense of smell, and neuropathy. B12 deficiency can be induced by chronic use of levodopa or malabsorption due to low gastric acid, which is extremely common in people with Parkinson's, gastric atrophy or loss of function, medication interactions, or an autoimmune process. We run a methylmalonic acid as well because methylmalonic acid will actually show up elevated in the blood or urine before our serum B12 falls. So if we run this panel to detect a B12 deficiency, we may be able to catch it, 1, before symptoms arise, or 2, before we hit a low deficit in our blood serum levels, and we can catch it a little bit earlier and treat accordingly. Uric acid, which is indicated in the pathophysiology of gout, is actually a central nervous system antioxidant at healthy levels. There are studies currently underway to determine the rates of progression associated with uric acid levels and its protection in the progression of Parkinson's disease. There is a supplement called inosine that can help raise your uric acid levels, but again, this is a conversation you should have with your healthcare provider to responsibly monitor your uric acid levels so they don't get to too high of a level so as to cause other pathologies in your body. A reference range for uric acid is over 4. We do ask people with Parkinson's to avoid dairy, as we know it's a risk factor for enhancing the progression of Parkinson's, and dairy actually depletes uric acid. So this is just one more reason that we want to avoid dairy. We run what's called an omega check in your body, and this is looking for your omega-3 to omega-6 ratios. Omega-3s participate in lipid membrane stability and function. They're neuroprotective and they reduce inflammatory omega acids like arachidonic acid. Omega-3s can also promote neurogenesis through BDNF synthesis, and BDNF stands for brain-derived neurotrophic factor, which is responsible for that neuroplasticity that we all look for, creating new synapses. It's also antioxidant, and it has been shown to reduce levodopa-induced dyskinesia. The deficiency is associated with a 40 to 50% higher rate of dementia in people with Parkinson's. When it comes to fish oil, we want to dose high and we want to dose quality. I've noticed a lot of unfortunate dosing restrictions on fish oil supplements in my practice. When I look at the label, sometimes it requires up to 6 giant gel caps to get a dose of 2 to 4 grams per day. So again, speak with your physician about a high quality fish oil that you can take that also gives you the therapeutic dose that we're looking for. Vitamin D is making the news everywhere now as an immune protective agent. It's a hormone and a neurotransmitter, and low levels have been associated with immune system dysfunction, cancer, osteoporosis, autoimmune disease, obesity, and risk of PD diagnosis. People with Parkinson's are more susceptible to insufficiency, which leads to faster progression. It also is associated with an increased risk of depression, dementia, impaired balance and falls, and reduced bowel transit time. Vitamin D supplementation also has been shown to lower hsCRP levels. The reference range that is optimal for people with Parkinson's is between 60 to 80. Please keep in mind that vitamin D can be toxic and is fat soluble, so it's stored in your body. Again, please have a conversation with your physician about appropriate dosing to maintain a healthy level of vitamin D in your body without hitting a toxic level. DHEA is what we lovingly refer to as our spunk and vitality hormone. This is the hormone that we measure when we see people with high levels of physical and emotional resilience. DHEA counteracts the effects of cortisol in the body. Low levels of DHEA have been shown to lead to faster aging and increased likelihood of getting any disease. The range that we'd like to see in people with Parkinson's is above 100. DHEA is a hormone and can be a risk factor for hormone-dependent cancers. If somebody is at risk to develop or has a history of cancer, this is especially important to have this conversation with your provider. F2-isoprostanes come from a urine test. F2-isoprostanes measure oxidative stress and lipid peroxidation, as well as cell membrane damage. This is equivalent to checking the rancidity of oil. So truly, we're actually looking to see how rancid is your body in the lipid membrane peroxidation process. Abnormal values have been shown to increase symptoms and result in higher UPDRS scores, also associated with the process of misfolding proteins that then accumulate in dopamine neurons and cause dopaminergic cell death. A Mediterranean diet, as well as other targeted supplementation, can help lower your isoprostane level. When we do a hair essential and toxic element test, lithium is one of the essential elements that we are looking for. Lithium is essential nervous system, has a lot of functions in the central nervous system to include autophagy, membrane stability. It also induces BDNF and neurogenesis, and it helps with magnesium homeostasis. People with Parkinson's living in lithium deficient regions are actually 80% more likely to show a deficiency than their non-Parkinson's counterpart in the same region. Lithium supplementation at a physiologic, not a pharmacologic dose has also been shown to help with dystonia and cramping and overall mood. Manganese is another essential element that we measure through your hair. Manganese is a cofactor in a lot of enzymatic reactions that promote antioxidant activity in the mitochondria, or the powerhouse of our cells that provide energy. Manganese is absorbed in the small intestine. Mitochondrial dysfunction has been implicated in the pathology of Parkinson's disease, and people with Parkinson's actually show more deficiency than they do toxicity. Keep in mind that manganese toxicity can also lead to a condition called Parkinsonism, which looks like idiopathic Parkinson's disease with the masked faces, the wide gait, and the slow movement, but they're less likely to respond well to levodopa treatment. Testing for manganese is a twofold benefit. We can determine both if you are deficient and need supplementation, or if you're toxic and need to be treated as such and perhaps have a diagnosis that's been confused with idiopathic Parkinson's disease. People at risk for manganism are welders and those who grew up or spent a lot of their time drinking well water. When we do a Sibo test, this is through the breath. We either give you a bolus of glucose or lactulose and give you a certain amount of time, and then you breathe into tubes, and we look for hydrogen and methane content in your breath. There is a 2-week workup before you do a Sibo test that your physician will go over with you in depth to ensure that we get accurate results. Sibo, or small intestinal bacterial overgrowth, is a condition in which non-native or native bacteria have accumulated and grown in your intestines in an exorbitant amount, creating distress and discomfort. It can also lead to either constipation, which is more prevalent in people with Parkinson's, or it can also show up as diarrhea. Listed below are some very common signs of Sibo. After we do the breath test and determine if this is a condition that you're working with, we treat this with a 6 to 8 week minimum dietary and antimicrobial treatment to help kill off the bacteria and then move them out of your body. And then we also add in some other restrictions to your diet to ensure that we're not feeding those bacteria to create those gases. In doing this, we can actually improve absorption, nourishment, and transit time of your bowels. So I have actually personally seen clinically a patient who had Sibo after treatment be able to cut back their levodopa use by 30% just because they were absorbing their medications more effectively, and a lower dose was proving to be just as effective as the one she was previously on. I want to thank you for being here with me today. I really look forward to a time when we can all be together again in person. I wish you all well through the 2021 year. If you want to contact me to go over your own lab results and get some guidance, I'm more than happy to do that. And you can schedule a 30-minute visit with me at Coeur d'Alene Healing Arts. The number there is 208-664-1644. I'm also currently accepting new patients and care providers as patients. If you'd like to participate in the CamCare study to provide Lori with valuable information and also help with the paradigm shift of research to help slowing the progression of Parkinson's disease in our community, please visit camcarepd.bastyr.edu. Again, I thank you, and I thank the Northwest Parkinson's Foundation. Be well.